And you're on.
I am on. Oh, okay. So I have a lot of thank yous, and I'm going to start with those first. First off, I want to just say I'm a really blessed person. A lot of the stuff that I have to say, whether it's here or as part of the educational committee or on social media, I acknowledge that I am a really blessed person. My veterinarians are actually all breeder vets. The man who owns the practice is Scott Dove. His deerhound was Best in Show at Westminster in 2011. And they have, they do lure coursing, they do all sorts of stuff with their dogs. He's had that practice, 40 years maybe? Probably longer, but then it would make him older and he wouldn't like that I said that, so. And he says he's gonna watch this, so. And then there's Natalia Kunze. She's a Kerry Blue Terrier breeder who actually won the breed and got pulled in the group at Crofts with her Kerry Blue. And the youngest of the vets there is Hannah Lunsk. Well, I'm not sure, she just got married, I don't know her new last name. And she's a second generation Irish Water Spaniel girl who is also very dedicated. And I am really blessed because we had a litter yesterday by C-section, and I know that I have somebody on call for me 24/7. So some of the stuff that I may say to you when I say establish a relationship with your veterinarian or go to your vet, I understand that I'm in a more fortunate situation than many because one of those three veterinarians is always on call for us. And I know that's not the case nowadays in modern veterinary medicine. But I would urge you all, if you have the opportunity, I have no patience with poor medical care. I would urge you all to look. I have a lot of people say, do you drive an hour and 25 minutes to go to the vet? Well, I'd rather drive an hour and 25 minutes to a good vet than 30 minutes to one that's gonna kill my dog. So, and I'm sorry to speak so harshly, but that's reality too. So, that's my preface. So we have a variety of things for y'all. This is a canine wilderness medicine booklet. Staples, unfortunately, so when Dr. Dove had this collated, it's done in order here, and the people who collated it for him did it in order backwards. So when I took this to Staples for the price of $483 for them to do 30 copies for us to have for this event, they promised to do it right. Did they? No. They did it exactly like we gave it to them. So, when you go to look for this, you have to look backwards. It covers a variety of topics from bee stings to bleeding to bloat, breathing, difficult births. It's a great, great reference. And our educational committee is providing them to anyone who wants one. If anyone feels compelled to make a donation, we appreciate it, but it's not required. So this is available over here, and it covers a variety of topics. My email address. So here's the challenge. Can you spell my name? My email address is sherrymosesgsd@hotmail.com. If anyone needs anything with regard to this or any other seminar or any other thing related to education or breeding, as I've just become the breeders education, it's the breeders coordinator. That's not for like breeders referral, that's actually for people like us who breed dogs. If you have a problem, you have a question, you have something, I may not know the answer, but I will help you find whoever it is that can do that.
Everybody keeps telling me you never return any phone calls.
No, Ken, that's you, honey. That's you. That's you. No. So what I have been telling people and I put on social media is text me.
Email.
I don't get most Facebook. I have like 3 old Facebook accounts. People message the old Facebook account. Yeah, that witch never called me back. Text me. And I'm telling you right now, if I don't answer, I got 2 hours of sleep last night and drove here because I committed to do this. It might be that I look at your message at 3 o'clock in the morning and I think, should I text them back right now? No. And then by the time it's a reasonable hour, I've forgotten. So I don't mind, I will never gripe, so-and-so texted me 4 times. I will never say that. So I'm telling you now, my number is 219-1647. Text me. Tell me you need something. I will get back to you, I promise. And if you don't hear from me within the day, text me again, please. Okay, so we have this booklet available for everybody. We also have not as many copies because the printer ran out of ink. But I can, if people text me with an email address, I will send you the link. This was from the youngest of the vets, the Irish Water Spaniel girl, who not only does confirmation, she also does field work with her dogs, so she understands being out on a hot day, working your dogs, and actually doing things. This is her little emergency list. I'm just gonna go over it real quick. Supplies. Fresh water, you should always have at least a gallon of water per dog. Well, that's not realistic, but you have to be able to have access to it. So, a thermometer. I tell people that get dogs from me, the first thing, if you call me ever and tell me, oh I'm not sure, Rhodey doesn't seem like he feels well. The first thing I'm gonna ask you is, what's his temperature? I don't know. Well, go get your thermometer and find out. And frankly, I'm a little OCD, but I have 2 thermometers because I am convinced that in an emergency, my old thermometer will not have a good battery and it'll be dead. I will also tell you that 30-second read thermometers are worthless because if you are violating a thrashing dog, the 6 and 8 second reads are way more your friend. So, thermometers.
Say that one more time. No, I mean, it's hard to hear, but.
Okay. It's all those years all over.
Come closer.
Yeah. Have a thermometer. If you're not sure if your dog feels well, take their temperature. That's one of my go-tos is this manageable or is this a crisis? You know, if the dog's temp is 102.4, yeah, okay, we're gonna watch it a little bit. You tell me the dog's temperature's 105, we're finding a vet. I'll take my chances even with the dicey ones. So, have a thermometer and spend the extra $2 and get the 6 or 8 second read. You do not want to have a 30-second read or, God forbid, a 60-second read with a thrashing dog that thinks it's being attacked. Just trust me. And have 2. Backup is good. Redundancy is good. I fly a lot. Redundancy is good. Bandage scissors. You should have scissors. A blood kit, which we have handily right here for you. Bandage supplies, a nonstick wound pad, gauze, vet wrap. So, and this is the thing. So she cautions us, and this is a good thing to remember. Everybody should have vet wrap, whether your dog needs it or you want to use it on yourself. But if it gets wet, it gets tighter, and you don't want to tourniquet your own arm or leg, or your dog. So when vet wrap gets wet, it gets tighter. So if you're going to wrap something, do it loosely. She has some recommendations about over-the-counter medications. One of the things I like about this and this, as I said to someone a little bit earlier, it never fails, but your dog isn't well, you're trying to figure out what to give them, you're trying to get service on your cell phone so you can calculate the dosage, and you're in a typical dog show site where you have 1 bar, and you're like, so it's all right here. So you can figure out what the dosage is, just do a little tiny bit of math. Your calculator will work even if the internet doesn't. Benadryl, especially in the summertime. Everybody should have Benadryl. If your dog gets bitten by a bee, it's the first thing you should do. Give your dog some Benadryl. Dramamine for motion sickness, betadine solution. You never know when a dog is going to do something stupid. They're going to tear their foot open on an X-pen. They're going to get bitten by another dog. Having a little bit of betadine solution to wash that wound off is a really good thing. Rubbing alcohol is a good thing. It's a great way to, in an emergent situation, to cool off your dog. She talks about having psyllium husk unflavored, and there's another article in here that talks about that. You don't want to give too much to dogs. Dogs take a lot less Metamucil than a human. So be judicious in your use of additives to your dog's diet. Gas-X. Gas-X is your friend, and it's in this bag also. Topical antibiotics, ointments, and hydrocortisone, and remembering that no corticosteroids ever for anything that you're breeding. If you have a pregnant bitch, steroids are not your friend. Veterinary medications. Pain medication, like Rimadyl. Probiotics, like Fortiflora or Probiable. They talk about Epiotic Advanced Ear Solution. I really like the Nolvasan product, it's blue. We've had dogs over the years that had what were supposed to be intransigent yeast infections of the ears, and it responded right away. But you should have that stuff. Something happens to your dog on the road, you're away for a weekend. You know, something happens on Friday, you don't want to wait till Monday when you're home to fix the dog. You want to do that right away. So the things that would be crises, you know, that's always the problem. You're here at a dog show, and it's like, okay, my dog isn't well. Is it a crisis, or can I watch this for a little bit? You know, and those are the questions we ask ourselves. And shoot, I meant to lead with this. So before I go to that, yep, hang on, hold on 1 minute. This is for me personally and the parent club in general. I'm going to read 4 different versions just so we make sure that we're covered. A medical disclaimer explains that the content on my site is for informational or educational purposes only and does not substitute professional medical advice or consultations with healthcare professionals. Hang on. The author or speaker assumes no responsibility or liability for any errors or omissions in the content of this. The information contained is provided on an as-is basis with no guarantees of completeness, accuracy, usefulness, or timeliness. You know, our last webinar, someone used a little bit of profanity and perhaps spoke a little off the cuff. So we had complaints. So here I am doing all of our CYA. So, definition.
Did you hear that in the back?
Wait.
Loud and clear, I heard it.
I am not a medical doctor. This is used by individuals discussing medical topics or providing advice related to health issues. It signifies that the person giving the information does not possess a medical degree and is not qualified to provide professional medical advice. Okay, so we're clear on that? Everybody raise your hands. Let's see a show of hands. Anybody disagree? Okay, so our parent club is not liable for the opinions I expressed today. All right,
This is all emergency care to get you to a veterinarian.
Yes, all I am suggesting to you is I'm trying to help you. I'm trying to tell you how I would think if I had my own dog and I was trying to decide, do I have to go find emergency care of whatever quality it is that there happens to be in this town? Or am I okay to manage this dog until I can get home? So part of that goes back to what I said before. It is, in my opinion, imperative that you have a quality relationship with your own veterinarian. I have told mine many times that when they retire and that practice closes, I will also quit breeding dogs. I may have 1 or 2 pets and I'll hunt one of them down at home if I have to, but I can't do this without them. So the question is, what's a crisis? Okay. So for me, like with temperatures, if the dog's temperature is over 102, I'm watching it. If it's over 102 and a half, I'm like, okay, were you running around? Is it a hot day? Are you dehydrated? What's going on? I'll put them somewhere and watch them and try again in an hour. If it's over 103, we have a problem. Okay, what are we doing about it? What do I think it is? Over 104, I am looking for a veterinarian. If it's over 105, I'm finding a veterinarian and I'll take my chances with the quality of that vet. That's just my opinion. That's what I do. The other thing that would be a big issue is what do their gums look like? Are their gums white? Dog with white gums is frequently going into shock. That or they're bleeding out somewhere that you don't know about. Are their gums blue? You know, if you don't have a chow, if the tongue is blue, they're cyanotic and you have a real problem. So you should familiarize yourself with what your dog's normal is. And I know that sounds goofy, but go take your dog, press on their gums, look and see what it looks like, see what the return is. See what color their tongue usually is. Look at the sclera of their eyes. Dr. Dove, 20 years ago, one of the keys for bitches going into labor, their eyes look muddy. They call it muddy. The sclera, instead of being white, becomes sort of brownish looking, and it's because of the increased blood pressure of the bitch causes all those little capillaries to inflame a little bit, so the sclera starts to look a little brownish, and that tells you that your bitch is either in labor or she's going in because her blood pressure is elevated. So familiarize yourself with your dog and know what's normal and what's not, because you know your dog best if you pay attention. Let's see. Bloat. Bloat is the thing that makes most of us have nightmares. We are really blessed, and this is another of my thank yous. For all our parent club, for a little bit, did not have the most perfect relationship, and this got wet. And this is a beautiful, in my opinion, this is a beautiful headed dog with perfect dark almond-shaped eyes. Purina in 2019 did a study on German Shepherds and bloat. They talk about a lot of things in this article. They talk about a decompression technique that will save your dog, that's relatively new, although we've been doing a version of it for 20 odd years, which we're gonna demonstrate in just a minute. One of the things they talk about in here is the bacterial factor. And I am here to tell you, what year was it we were in Canada with Myra Shear's Juicy? 20 years ago? Close?
Close, I'm sure.
Yeah. So, we all think of bloat as being, now we're back to my personal opinions. I think you can get bloat that's familial. There's an argument, I think it's in this article, pretty sure, that there's a ligament that helps the stomach stay in place that gets hyperextended, whether because the dog's chronically overfed or, is one of those dogs that wants to go drink 10 gallons of water or whatever, or maybe God made them that way. There's an argument for that. So you can get bloat that's familial, and then you can get bloat that's incidental to old age because maybe the gastric system isn't working quite the way it should, and now they're 10 years old and gassy or whatever.
Muscle
And in between, you can have bloat that happens as a secondary effect to something else. And part of the thing here is it's almost like what Bob said earlier about you have to be honest with yourself. You can't always make excuses for everything. You have to be brutal, and the key to success in this, or being able to sleep at night, is to be brutally honest with yourself about what's going on with your dogs, to the best of your ability. So, 20 odd years ago, I had always had the thing about bloat was something that happened to older animals. Myra Shear bred a lovely bitch to Bailey when I was living in Wisconsin. And I was helping her with that litter. And when they were very young, they contracted a Campylobacter infection, which the vet kind of screwed around a little bit, but finally treated them with erythromycin, which is the drug of choice, although it's not readily available today. And the puppies were treated and went on about their way. Fast forward a few months, we're in Canada at the Canadian National, and at 8 o'clock in the morning, the puppies were fine. We had two girls with us. One was Myra's, one was mine, and went out at 11 o'clock to X the dogs again, and the one puppy looked like she had swallowed a watermelon. It was huge. I'd never seen a puppy like that. And long story short, it was a really interesting treatment. I want to say Dawn got us to a local veterinarian that was kind of old school, and they were able to pass a tube on the puppy. The gas it was like all this gas and fluid. It was very foul smelling. And we got the puppy in, and while they had her on the table, she actually basically flushed the dog's gut with an antibiotic solution because the dog had a terrible overgrowth of the Campylobacter she had had as a puppy. So clearly that infection had not cleared, and the stress maybe on the road or whatever, it had come back, and people don't realize it, but bacteria produce gas. And this is the other thing that makes it important that we have, that's a whole nother educational video on the importance of good gut flora. You know, we casually give our dogs antibiotics, we do this and that, we feed them whatever, and we don't necessarily give them good probiotics. And a lot of people are like, oh, my dog doesn't need that. Well, you know, but if you've ever given them antibiotics, and humans too, if you have done things to screw with the gut biome, you really should consider a really good probiotic for your dogs. It's really important. Purina makes a great one. I'm very grateful to Purina for doing this study for us. And we're gonna try to get this on the website. We've got copies here. We're gonna try to get this on the website.
Right, Mr. Website Man?
I'll send you home with a copy, Mr. Brown. And I asked Annie Bellatti's permission, and we have it. So, just saying. Anyway, so, this puppy, she flushed the dog's gut with antibiotic to get the total number of bacteria down, and then treated it appropriately. So, bloat happens for a lot of reasons. Again, is it your breeding program? Is it happenstance? Is it management? You know, it's just a reality for us. So, we can try to prevent it however we want, but when in doubt. And these cute little blue bags were donated by Donna's clinic, Acorn Veterinary Medicine. And inside this we have,
We call them the ugly bags. We were happy to get rid of them.
we like Heartgard.
I know, it works.
All right.
The girls think, oh, they're ugly.
So while I was sitting with my puppies, I made bloat kits.
Isn't that what every breeder does at
Oh,
night?
absolutely. Gas X is your friend. If you're not sure, give them a Gas X. When in doubt, give them a Gas X. It will not hurt them. I'm going to tell you frankly, I've had 2 hours of sleep in the last 2 days because I have puppies at home, and I drank too much Diet Mountain Dew, which is really hideous, awful stuff, but it did keep me awake to survive the drive here. And I stole one out of somebody's pack because my stomach was really upset. So if you're the person who gets the kit that's missing one of these, I'm sorry, it was me. So Gas X is your friend. When you're not sure, pop a couple of these down. And, you know, if they don't need it, okay, you're good. If they did need it, you know, we had a case once upon a time at a futurity weekend where somebody beat on my door at midnight, and we took a client's dog to the vet, and, you know, we popped some Gas X in on the way, and got there, and it didn't look that big, but sure as can be, as soon as the tube went down, foam is coming out everywhere. So, it really does help.
So for people that don't understand, I don't know who's here that does, could you tell them what are the signs, clinical signs? You take your dog out of the crate and all of a sudden,
Yeah, okay. I thought we all had enough nightmares.
well,
but
there's
okay.
some
Yeah,
new
you're
people
right,
here
right,
that
right.
don't know.
So the dog comes out of the crate and they're hunching their back. They might be, they're gonna have some gastric dilation. As the tech at the clinic put it, in a bad case, it's gonna look like you're beating the drum. I mean, they're gonna look like pregnant, only with an arched back. The dog will be trying to ease the pressure on their abdomen. They might be trying to vomit. They might be trying to poop without much success.
Eating grass?
They could, so if they've got a gastric upset, they might be eating, or they might be eating wildly inappropriate things. I once had a dog decide to, out of the blue, at 7 years of age, try to eat my draperies. And I thought, what in the world is wrong with you? Well, it became apparent pretty quickly. And it's basically their gut isn't right for whatever reason, whether it's gassy or they're bloating or whatever. Their gut is giving them an issue, so they're responding to that. In a severe case, the gums will be going white. The dog is going into shock. So if a lot of times people are like, oh, how do I know if it's bloat? Trust me, if it's bloat, you're gonna look at it, you're gonna know. It's inherently kind of obvious. The symptoms leading up to it, maybe not so much, but pretty quick, you're gonna know. So Gas X down the hatch. Now, if the stomach so what happens in bloat is whether it's because of air, because of gas, or because the dog drank 10 gallons of water, or they ate a ton, they knocked a bag of food down off the shelf in the hotel room and they ate the whole bag, and their gut has gotten huge, and then they're running around and it's twisted. If it's twisted, the gas X isn't gonna go where it needs to be, but you're gonna have tried. If the stomach is still, if they're gassy but it hasn't twisted, you'll see bloat or GDV, gastric dilation with volvulus. If it's twisted, and I'm probably jinxing myself here because it's been a while, but here I am. So if it's twisted, the tube isn't gonna pass. If the tube won't pass, the problem is, once that torques, it's like a tourniquet. Your dog's blood supply is cut off. Mr. Brown will tell you that I reamed him out up one side and down the other because we had this conversation, and I told him what to do, and he's like, no, I'm going straight to the vet. And by the time he got to the vet, the stomach tissue had died, and my dog, this was 20 years ago, my dog died. Is that true or not true, Mr. Brown?
Probably.
It was the Jenny daughter. Yeah. Because he didn't want to do it, because it seems freaky. It's like, oh God, I don't know if I can do this. Well, look, your dog's gonna die if you don't, probably. So it makes it easier to do. You're not gonna kill the dog. Dog will die if you don't. Makes it easier to get a little courage. Okay. Right. Little intestinal fortitude, that's always fun. So I've had to do this myself twice. Once with a dog I own with a dear friend. Yeah, Miss Maggie. And once.
One of her runaway bride who ran away.
Once with a client's dog.
Yep.
And once upon a time, I talked my then 16-year-old daughter over the telephone, because she was at home when this happened. I talked her into how to do this so that the dog would survive the 2-hour trip to the vet. So if my 16-year-old child can do it, so can you. The way this all started, we had a dog named Pete that we were showing, and the dog was from a litter that they had an issue. But bottom line, the dog was bloating, went in. I ended up talking to the dog was not salvageable, and it broke all our hearts because he was such a sweetheart. And my veterinarian, who at that time was a bulldog breeder in Atlanta, showed me what to do to not have this happen hopefully in the future. And we'd also lost a client dog that we got to Cornell. We were on the wine country circuit. We got her to Cornell, but it was too late. Because once the stomach flips, you have tourniqueted that tissue, and there's no blood flow. So once that tissue dies, doesn't matter if you flip it back over. If the tissue's dead, it's dead, and they cannot save your dog. Okay. Anybody have any questions to this point?
How can you tell when it twists, if it's not just blow, it twists?
Well, if you can't pass the tube,
Okay.
it would be the first sign. If you can't pass the tube, then I would move to step 2.
Okay.
So,
Which is?
and we're getting there. So, the idea is to decompress the pressure on the stomach long enough to get you to the vet. In the case of Miss Maggie, we were at the Futurity weekend that was held halfway between Memphis and Little Rock, Arkansas. We've been showing dogs all day. I came back to the setup. There's my bitch laying on her side looking like a bloated cow, and it's like, oh crap. So of course I had a bloat kit with me because my vet had told me what I should be doing. We tried to pass the tube. Actually, it was Peggy Kurz that tried to do it. Tube wouldn't pass. Dee Ardwan drove me to the vet. Claradine Hope found a veterinarian for us. Drove us there.
That was Arkansas or Memphis.
I knelt in the back seat of an Expedition and kept putting every time she blew back up, I put the needle back in and kept decompressing her. And the bitch lived. She did really well. Everything was fine. Same thing had basically happened with my daughter. It was a 9-year-old bitch, Ken Delane's Katerina. And my daughter did the same thing. I talked her through it over the telephone. Got her to the vet 2 hours away. And actually, with Maggie, we walked through the door of the emergency center, and they were like, you know, why are you here? And we told them, and, oh, she's not bloated. I'm like, yeah, she is. They didn't believe me till they did the x-ray. It was a full twist. But we had her decompressed enough that we, you know, it can twist as long as it doesn't swell, it doesn't cut off the blood supply. It can flip and you still have blood flow. Once it blows up, that's what cuts off the blood flow. So, may I have my demo dog, please? In this bag, we have 4 feet of tubing. We have gas X, and we have a 16 gauge needle. Hi, buddy. Hi. How are you doing, sweetheart? Give me my demo dog. All right. So, first thing is we have the tube. Yeah. So, 5 feet probably would have been better. 4 feet's good enough. So the idea is you're gonna look at the dog. It's almost like, for those of you who tube feed puppies, you're gonna look at where the dog's stomach is, and you're gonna go to the corner of the mouth. Okay, that's good enough. The idea is you're gonna be able to pass this tube down his throat. The dog will swallow as you're going. Let the dog swallow. Don't try to shove it down. Let the dog swallow as you go.
Sometimes it's a little difficult if they're a little stressed to try to get that down, so you're swallowing up, maybe.
And that's why we have this. So this is a nice little roll of adhesive tape. What you're gonna do, and I'm not gonna do this to this dog because it's straightforward enough. And honestly, when a dog is bloating and in serious trouble, they might be stressed, but a lot of times they're kind of zoning out on you by the time you figure it out. So you're gonna rip a few pieces off this roll of tape and stick them on the table or to the person or whatever. You're gonna stick this in their mouth, and you're gonna have made a thing that you can pass this tube through. So the pieces you ripped off, so you stick this in the dog's mouth. Is he gonna let you do that? What a good boy. What a good boy.
If he wasn't, he is now.
If you take this, I mean, if you kind of wrap that like that a little bit, and then put that in there like that. If that was a 2-inch, if that was a, you know, like a 2-inch thing of that sports tape, if you stick that in his mouth and wrap a couple of things around, that's gonna keep him from chomping on that tube so
you
much,
can
and you'll
pass
be
the
able to
tube.
put the tube down through
And that
there.
way you can pass the tube. Now, the tubes tend to, you may have to stretch it a little bit so that it's not quite so curled.
What about some like lubricant to get it down?
You can, but they're gonna swallow. It's
You know, the other thing I like to, on the tubes,
Round it.
I take
Round the
like a
edges.
Dremel tool and round that off so you don't have a sharp edge when you're sticking
Right.
that
So you're
down
not-
through his
so you're not
esophagus, and then
scraping.
if you put a little lube on there, that'll go down a lot easier, you know?
And let them swallow as they go. Same thing as passing a feeding tube on a puppy. They swallow as they go, and so you have, give me the tape back, thank you.
Hey.
So you have your tape, you have the tape to put around. This gives you, so the dog can't bite down on the tube as you pass the tube.
Can I say one other thing?
Yes, sir? You're sounding like
Nature's
somebody's done this.
Pharmacy has what they call a bloat kit. I think they've got like a little wooden apparatus that
They
you
do.
can stick
They
in
do.
there, and then it's
I
got
have
a
it.
little
They do.
rubber band deal. It's got a tube in there, and the bloat buster product.
So, which is basically gas
Pretty
X.
slick. Yeah,
So,
exactly.
if that doesn't work, you can't pass the tube because the dog's stomach is twisted, or you can't pass the tube.
Yeah.
So the dog, hi sweetie, hi, hey booger, I'm here.
How far would the tube, like, if you got the tube down
So
and it was twisted, how, like,
it's not gonna,
That's
it's
the
not
one
gonna
you're
go
really gonna
far.
get
it's
it
gonna
about.
hit just like right
Yeah, and you're
there?
gonna get nothing out of it. So when that tube slides into the stomach of a gassy dog, there's gonna be fluid coming out, it's gonna stink to high heaven, it's gonna be nasty, you're gonna know.
Another question a lot of people have, excuse me, is how do you know you're hitting the gut and not the lung?
Because the dog's not coughing their heads off.
Okay.
And if you let the dog swallow as it goes down, if you go down the wrong, if you let the dog swallow as you go, and most of these dogs are gagging and swallowing, they're already gagging and swallowing. So most of them will just swallow it. If you go down the wrong pipes, The dog will be coughing and hacking. Again, for those of you who've ever tube fed a puppy, pull it out and go and try again. If you look at the corner of the dog's mouth to where their stomach is, so if you get this much tube down, you got a problem. You know, and if you're all the way in, you're gonna know, because you're gonna be getting stuff out.
Do you need to suck on the end of the tube sometimes?
You can. I have never needed to do that, but I've only done this a few times, fortunately. I've had people tell me that they did. I don't know that it was necessary.
Terry Howard years ago used to have this little pump deal where he could actually take and try to pump the stomach out. I've never really seen one since, but Terry used to carry that in his truck all the time.
You worked for Terry. What happened?
Terry always had the tube, and he had a little pump deal that he could, you know.
But
just
we're back
almost
to the
like
whole,
pump
if it's in the
out.
stomach, stuff is gonna start to come out because it's under pressure.
You don't
If
remember?
it wasn't under pressure, you wouldn't be doing this. So,
So what's in this, you know, like a syringe that would go around to start sucking.
well, but if nothing comes out, you know you're not going by. At which point we have our 16 gauge needle. This is a 1.5 inch needle. So the dog, if this dog was bloated, he'd be arching his back, his sides would be distended, it would feel like touching a drum. You're gonna go right behind this last rib.
On the left side.
Well, actually, I start on the right, that's just me. Start on put pressure on this side, you're gonna have somebody holding the dog, ideally. Pressure on this side, right behind the last rib on this side. Having done this, it sounds like wet air coming out of a bicycle tire. I mean, like this wet, yeah, exactly. Yes, just like that. If
Gee, you know.
if you do this and you get blood, not air, maybe the spleen flipped, you're gonna switch sides and do the same thing on the other side. It's not, I mean, now the trick to that is you're gonna have somebody holding their head, you're gonna decompress the dog. Do not leave the needle in the dog. If the dog thrashes around, they can lacerate the stomach because of the needle. You don't wanna do that. You wanna decompress the dog, pull the needle out. If it's gonna take you, like it did for me, 2 hours to get to the vet, and we're good. Everybody understands, right behind this last rib. Okay?
And you put the needle in.
Just like, boom, right there.
Sherry, do you press on the stomach a little bit?
I do I push on one side and do I press on the other opposite side, and at least that's how I did it in the past, and it worked really well.
And
I
how
have-
long would you keep it in until you put air in there?
Well, if the dog is holding still, which usually they're pretty miserable. When Dee Dee and so Dee Dee was driving the expedition like a mad person, but there was construction, so it took us 2 hours to get to that veterinary clinic. We walk in the door, and the people said at the emergency center, "This dog isn't bloated." And I'm like, "Oh yeah," and it was a full twist. So partway through surgery, they said she's going to be here for a few days. We turned around and go back the 2 hours back to the show site because the Futurity weekend was ongoing. And partway through surgery, they called, or we had called and said, "Hey, what's going on?" And they said, "Well, they're not sure. They might have to resect a little bit of tissue. But, you know, the surgeon will call you when he's done." So the surgeon called when he was done, and I said, "Did you have to resect part of the stomach because of tissue death?" And the surgeon said, "No." He said, "How many times did you have to stick her?" And I said, "I don't know. It was a 2-hour drive. It was a lot. Every time she started to blow up again, I stuck her again." We were in the floorboard of the back seat, and I was basically kneeling over her. And whenever she started to look like it was getting swollen again, I popped her again. And I said, I don't know. He said, "Well, what we initially took to be tissue death was actually just bruising from all the needle sticks, but she's fine, didn't have to, her spleen was good, everything was fine. And she lived a great life. And so did the 9-year-old that my daughter did. But this will, it's almost like, for those of you who have ever had livestock, it's like cows that bloat. They stick the knife in.
How long do you leave the needle in?
Well, when I did this, I put pressure on the one side until the stomach decompressed, you know, and you hear the air coming out.
Okay.
You hear it decompress, then as soon as it was decompressed to where it seemed reasonable, I put the needle out. Good job, Diane. You know, when she started to swell up again, I slid it back in as we were making our way to the vet. I mean, this is a problem if you're the only person there. It's ideally you have somebody that can drive you while you're managing the dog. And hopefully your veterinary care isn't too far. That's the other great thing about this article with Purina. They talk about a decompression technique. Another issue in the past has been that even if you got the dog to the vet right away, they took too long to get them into surgery. Right. You know, they want to.
They do blood work,
evaluate for
X-rays,
2 hours
all
while
the
your
bullshit.
dog's stomach is dying, and that's not acceptable. This article was done in 2019, so we're back. I'm sorry.
Are you done with that?
We are done with him. He's been a great guy. Thank you so much for your participation.
Yay, thank you.
And the impromptu temperament test. So, yeah, so this is something you probably should have a plan in place. You know, if you have any deep-chested breed, whether it's a German Shepherd or a Weimaraner or an Irish Setter or a Great Dane, you know, do you have a veterinarian who is able to do this kind of surgery? And if not, where are they going to send you? What's the procedure? So many emergency clinics nowadays don't even have a surgeon on staff. You know, and they want to tell you, oh, we're going to stabilize your dog. Well, unless they use a stabilization technique that the Purina article talks about, I mean, starting fluids on a dog with a full torque on the stomach is not going to help your dog. So at that point, you have to help your dog. And I know it sounds extreme, and I have people say, oh gosh, I couldn't do that. If the alternative is your dog dies, you can certainly do this. It's not that big a deal. Just don't leave the needle. Pull the needle out, get him decompressed, pull it out. You have to stick him again, stick him again. Anybody have any questions? Okay, all right. Well, in that case, let me start. Anybody that is interested in one, we have our handy little, thank you so much for everybody helping us, and we appreciate it. For those of you who want some of this stuff, we have blood kits in the blue bags. We have the emergency medicine articles in here. Again, they're in reverse order, but it gives you dosages and suggestions and just the basic things of leaving the dog. And these are the articles from Purina.
Thank you everybody for coming.
And all the stuff they do.
All donations are appreciated. This cost us some money to put on, but for everybody's benefit, we certainly want to help everybody in our club. Thank you, good night.